kind of gags me. So.
It's, there's nothing like...
Is there any fragrance now?
Where? Any fragrance? No, your feet are great.
And I understand completely how very important it is. And before that last appointment that I had to miss, this foot was, I thought, oh, it's really starting to respond to the Vicks.
Oh, on your nails?
Yeah, they didn't look, what do you call it, dark. And of course it wasn't the worst foot ever. And this one was beginning to, but I think I need that grinding you did with that drill to really make, because even the most coarse emery board I've found doesn't work as well as the...
So are you still putting Vicks Vapor Rub on your nails every day?
Yeah, and I'm trying to do it especially when I right out of the shower, because I figure give it a swipe with the emery board because it's softer. I mean, it just came out of the shower, and then I just sit there on the toilet and put my feet on a little, stool, and get that on, and don't have a shoe or. But that means you got to time your shower when you're not about to go to someplace. And then I think he wanted me to do it twice a day, and so I try to do it, like at night if I'm sitting watching a show or something, and I can just bend my legs up in the recliner.
Well, do you feel like it's made a difference in the appearance of the nails?
Well, it was certainly on that foot, but this foot is...
On the foot I'm working on, you feel like it helped?
Yeah, I think it was making progress until I got into all these problems. And
So what's been going on?
well, as far as I can tell, I think one major underlying problem is that this diagnosis of severe major recurring depression that I've had for a long, long time was pretty well managed with 30 milligrams of Lexapro. Well, as I aged more, the psychiatrist said, well, you're having trouble because you're taking too much for your age.
Of the Lexapro?
Yeah, because apparently as your physiology ages, then you don't respond to the same medication you may have been taking.
Yeah.
And, oh, is she filming?
Yeah.
Oh, and I'm backing my head off? Is that
okay.
audio?
It is, but if you don't want it on there, we won't use it. I mean, nobody knows who you are.
I know, but does it mess up your...
Not at all. People, at any of these conversations we have, there are people out there who will say, thank you for talking about it because I was wondering the same thing. Or I also have depression and I was wondering why my Lexapro wasn't working, or, stuff like that. But if you're...
Did I mention... No, I said psychiatrist.
Yeah,
I didn't say...
But nobody knows who you are or anything. So if you're not comfortable, I won't put this out there.
No, but what I meant was, is there a way you can remove the audio but not the video?
There is.
But it's probably expensive and a big mess.
No, but...
Well, I won't say anything else. I'll just... Oh, and I said all that stuff about...
You know what? Why don't we just stop videoing?
Yeah. Well, no, I don't want you to do that because this is obviously a pretty good example of it.
All right.
Of what happens when... Well, that's what happens. That a lower dose doesn't really do it, and you're kind of limited, I guess, on what really helps.
But there's all different medications to try
Yeah.
too, so.
But then you're stuck in this weaning off one, and then you have to build up to another, and I'm kind of, with the regimen as it is,
Mhm.
And with the other things that he has prescribed, you feel like you're already just kind of barely keeping your head above water, and so keep thinking I need to reach a point where there's not all these decisions and problems with any decision you make about,
But you have to give them time, it's
Yeah.
not gonna be immediate, and you have to just be gentle with yourself in the
See,
meantime.
look at that all piled on top
Yeah.
of that. That looks just like nail, and why is it on top?
Well,
Oh, because it's come off a couple times, I
yeah,
think.
a lot of this is just skin, some of this is nail.
Because that was an ingrown nail,
Mhm.
the one and only I ever had. And the podiatrist told me that there is a not, I guess it.
Condition?
Yeah, that it has, I don't think he actually said the word gene, but in other words, you can be vulnerable to it, or am I misremembering that, or?
That some people it tends to run in families whether people get the fungal infection.
And that's
It can
Yeah.
because, some people have an immune system that fights it off better than others.
Well, my dad, I don't think he had any trouble with it until he went to, he was a B-17 pilot
Mhm.
in New Guinea.
Mm-hmm. Oh, yeah.
And, when they had to rev up all the engines, to take off, and of course it was very humid there.
Well, when I first started, I saw a few Vietnam veterans. So this was in the 90s, so
Oh.
now they'd been going 30 years with painful fungal infections
Oh,
on their feet
you mean not just the nail, but,
and the skin,
oh,
and because they had trench foot, because they had been walking through
all that swamp
Mhm.
and water all the time, and
Yeah.
then an enclosed boot.
Yep. And so the medications at that time, the oral antifungal medications, were worse, the side effects were worse than the disease, so they didn't take anything.
Well, yeah, like I was afraid to start taking, because it said some of these things are permanent, and the side effects, and so I just was afraid to.
Right, so for some of these guys, let's just turn your foot a little bit that way, there you go. When, around the time that I started was the next generation of the antifungals, and I was able to put some of these veterans on these fungal infections, and for the first time in 30 years, they had relief
Oh,
from the trench foot and severe pain and.
how is the trench foot different from the fungus? It is a fungus.
It's caused by a fungus, and it affects the skin mostly,
Oh,
and the nails, but really it was the skin had all kinds of cracks in it,
oh,
and
gee.
was very painful, because they'd been dealing with it for 30 years.
Well, what were they doing to be able to walk, or if they didn't live in a climate where they could wear flip-flops?
Yeah, they had a tough time.
They had to what?
They had a very tough time,
Oh, yeah.
many of them.
How sad.
Yeah.
But just, they keep paying such a high price for the few paying such a high price. Well, how is,
Let me get this Callus over here.
you want me to
Yep.
move my
Nope,
right
you're
foot?
fine. You're fine.
How is it a different fungus than the toenail fungus?
Nope, it's all the same fungus.
What's the name of it?
It is in the class called dermatophyte.
Oh, dermatophyte.
And it just stays in the skin and the skin structures like nails.
Well, see, I don't remember my dad ever having a problem, or relating that he had a problem with it until he spent that time, you know, camped out in a tent
In New
the
Guinea.
jungle. Yeah, in
Yeah.
New Guinea. But that business of the temperature got up to 120 in the cockpit. Yeah, taken off.
Dry skin, not callus.
I think I just, regardless of what shoe I'm wearing, my flat feet just pronate in.
Right.
That's the right term, I think.
Yep, and that's what causes the calluses, so nothing you're doing wrong.
Do you ever just sit down to do the whole trim? Your poor back.
No, I sit, I stand, it all works. It's like having a desk that you can sit or stand at,
Oh,
so.
oh, thank you.
Yeah, it looks like a different foot, doesn't it?
Pardon?
Looks like a different foot.
To say the least. And I so appreciate your tolerance and,
Yeah. Where's your socks?
oh, I don't have
You
some.
don't have socks on?
Yeah, I'll,
Okay.